If you look at social media, you can see how many procedures are performed that aren't indicated. The person that had the procedure shouldn't have had the procedure because, number one, it was not necessary because the patient anatomically didn't need it, but worse even, now the patient looks unnatural, looks operated, and when you look operated and unnatural, I feel you're defeating the whole purpose of what we're trying to achieve. As cosmetic surgeons, what we're trying to achieve is improvement and subliminal changes that no one notices. If someone had, for example, a lip lift surgery, meaning lifting their lips, that they didn't need because their lip length was not too long and it was perfectly normal, but they lifted the lips just to get more fullness of the red part of the vermilion of the lip, but now the lip is super short, throws the whole face out of balance. That is not a complementary thing, so it doesn't look natural. Anyone can tell something doesn't look right. It catches the eye, and therefore, to me, it's a failure. Another thing is foxy eye trend, to really lift up the eyebrows and the cat eyes or the fox eyes. I mean, come on, I mean, at some point you're gonna have to really think about, does that look even real? And you might like it today because it's a trend, but are you gonna like it in 2 years or in 5 years down the road? Is that reversible? Well, in case of the fox eye or the lip lift, those are non-reversible procedures. Facelift, however, you can revise, you can improve to some degree most of the time, but you still have to be careful. So, moral of the story, if it doesn't look natural, don't do it because you're defeating the whole purpose of aesthetics and beauty.